Welcome to our Medicare Part B Resources and Training Tips for Skilled Nursing Facilities video series. Today, we will be exploring prior authorizations for therapy services. What does it really mean when an insurance company tells you, prior authorization isn't required for physical, occupational, or speech therapy services? On the surface, that sounds simple. But in reality, it isn't always that straightforward. Here's why. Prior authorization requirements depend on two major factors. 1. The individual's plan benefits. 2. The network status of the rendering provider. That means the facility where the services are being provided, not the ordering physician. For example, if the member has a PPO plan, it's often true that prior authorization is not required. However, if the member has an HMO policy, things can get a lot more complicated. In those cases, you'll need to ask a different set of questions to determine if prior authorization is truly required. Another critical piece to consider is whether the patient's plan has a benefit limit or a cap on visits. You'll most commonly see these limits in commercial or marketplace policies. And keep this in mind, if a plan does have a visit cap, most insurance companies will not go beyond that limit, no matter the medical necessity or circumstance. But remember, being told prior auth isn't required is never a guarantee of payment. Reimbursement is still based on medical necessity along with the benefit plan. That's why clear and consistent documentation is absolutely essential. So, here's the key takeaway. When you hear that prior authorization isn't required, don't take it at face value. It doesn't always mean you're in the clear. There are always additional questions you should be asking to avoid surprises down the road. That's where MNS comes in. Our team goes beyond the surface. We verify benefits in detail, check prior authorization requirements for Part B therapy services, and make sure you're on the right path from the very beginning. When it comes to therapy services and insurance requirements, the details matter. MNS makes sure that no detail is overlooked. You can trust our clinical experts who bring decades of clinical expertise in the skilled nursing setting to our partnership, and who will work by your side through the entire process. MNS Clinical Solutions. Simplify managed care.